Your doctor just told you your blood pressure is 145 over 90. She's reaching for her prescription pad. More medication, she says. We need to get those numbers down. But what if I told you that for someone your age, that reading might actually be protecting you? What if lowering it could put you in serious danger? I'm Dr. Arya, and I've spent 25 years specializing in geriatric medicine, working specifically with patients over 65. And today I need to share something with you that might contradict everything you've been told about blood pressure, because there's a dangerous range that nobody talks about. It's not too high, it's too low. And millions of seniors are being medicated directly into it right now, this morning, with their breakfast pills. Let me tell you about Margaret. She came to my office last spring, 78 years old, sharp as a tack her whole life. Ran her own business until she was 72. But when I met her, she couldn't remember what she had for breakfast. She'd fallen twice in the past month. Her daughter was terrified, talking about memory care facilities. I looked at her chart. Blood pressure, 112 over 68. Her previous doctor had called it excellent. I called it dangerous. We adjusted her medications. Within 3 weeks, Margaret was back. She remembered our conversation from the first visit. She hadn't fallen once. Her daughter cried in my office. This happens more than you think. And it's completely preventable if you know what to look for. Here's what I need you to understand right from the start. Blood pressure guidelines were written primarily for one purpose: preventing heart attacks and strokes in middle-aged adults. That's where the research dollars went. That's where the big studies focused, men and women in their 40s and 50s with desk jobs and stress and too much fast food. For that population, lower pressure genuinely does reduce cardiovascular events. The science there is solid. I'm not questioning it. But then medicine made a fundamental error. We took those numbers, those targets, and we applied them to everyone. Your grandmother, your father at 82, you at 70. Same target, same medication approach, same aggressive push to get numbers down. Nobody stopped to ask a critical question. Does a 75-year-old body respond to blood pressure the same way a 45-year-old body does? The answer is no, absolutely not. And the consequences of ignoring that difference are playing out in living rooms and emergency rooms across the country every single day. So what actually changes as you age? Let's talk about what happens inside your cardiovascular system after 60, because this is where everything shifts. Your arteries, those vessels that carry blood from your heart to every organ in your body, they're made of smooth muscle and elastic tissue. When you're young, they're flexible. They expand and contract with each heartbeat. They absorb pressure. They adapt. But after decades of use, after millions and millions of heartbeats, that elastic tissue gradually becomes stiffer. It's not disease. It's not your fault. It's called arterial stiffening. And it happens to everyone who lives long enough. Think of it like a rubber band that's been stretched 10,000 times. Eventually, it doesn't snap back the way it used to. Now, here's what that means for your blood pressure. When your arteries are stiff, your heart has to generate more pressure to push blood through the system. That's why blood pressure naturally rises with age. It's not a malfunction, it's compensation. Your body is working harder to maintain the same blood flow to your brain, your kidneys, your muscles. This is adaptive. It's your body solving a problem. And when we see that slightly elevated pressure, 140, 145, even 150, and we immediately try to force it back down with medication, we're fighting against your body's own survival mechanism. We're removing the compensation without addressing the underlying stiffness. And that creates a whole new set of problems. The second thing that changes, and this one is crucial, your pressure regulation system slows down. You have these incredible sensors built into your blood vessels called baroreceptors. They detect pressure changes in real time and signal your brain to make adjustments. Stand up, pressure drops, baroreceptors fire, blood vessels constrict, heart rate increases slightly, pressure stabilizes. The whole sequence takes about 2 seconds in a healthy young person. But after 70, those baroreceptors don't fire as quickly. The signal is delayed, the adjustment is slower. And if your baseline pressure is already sitting at 110 or 115 because of medication, there's simply not enough reserve. You stand up, gravity pulls blood to your legs, pressure drops, and for 5, 6, 7 seconds, your brain is running on inadequate blood flow. During those seconds, you feel dizzy. You grab the wall, you sit back down, maybe you fall. And everyone says, well, that's just what happens when you get older. No, that's what happens when your blood pressure is too low for your body to manage positional changes safely. Let me give you a number that should be on a billboard. In adults over 75, systolic blood pressure, that's the top number. Below 120 is associated with a 40% increase in dizziness-related falls compared to pressure between 130 and 145. 40%. We're not talking about a minor difference in abstract risk. We're talking about nearly half again as many serious falls. And if you're over 70, you know exactly what a fall means. It's not like tripping in your 30s and bouncing back up. It's a fractured hip, a broken wrist, a head injury. It's 3 months of recovery if you're lucky. It's the end of independent living if you're not. I've seen it hundreds of times. A patient comes in, blood pressure beautifully controlled at 115 over 70, falling every few weeks, and nobody connects the dots. Here's the range that puts you at risk, and I want you to write this down. If you are over 65 and your systolic blood pressure is consistently below 120, you are in the danger zone, not the safe zone. The danger zone. Below 115, the risk increases even more. You're looking at significantly higher rates of falls, cognitive impairment, fatigue, and paradoxically, higher overall mortality. Yes, you heard that right, mortality. Having your blood pressure too low at your age can actually shorten your life, not extend it. This isn't my opinion. This is data from multiple large-scale studies published in the last decade, studies specifically on older adults, not middle-aged populations. The evidence is there. It's just not making it into everyday practice fast enough. Now let's talk about what too low blood pressure does to your brain, because this is the part that terrifies me most as a geriatrician. Your brain is an incredibly demanding organ. It weighs about 3 pounds but uses 20% of your body's oxygen supply every minute, without interruption. It has almost no capacity to store energy. It depends entirely on continuous blood flow. When that flow drops even slightly, even briefly, brain cells start to suffer. In a younger person with good vascular flexibility, minor drops in pressure are corrected so fast that the brain never notices. But in an older adult with delayed baroreceptor response and medication-lowered baseline pressure, those brief drops happen constantly. Every time you stand, every time you bend over, every time you turn your head quickly. Each episode might only last a few seconds. You might not even feel dizzy every time. But your brain is experiencing repeated moments of inadequate perfusion. And emerging research is increasingly linking this pattern to accelerated cognitive decline. We're talking about vascular cognitive impairment. It doesn't look like Alzheimer's. It looks like slowed thinking, difficulty finding words, trouble concentrating, memory lapses. The patient and the family assume it's dementia. Sometimes it is. But sometimes, and I see this regularly in my practice, it's chronic underperfusion caused by overly aggressive blood pressure treatment. And the tragedy is, it's reversible. Adjust the medication, raise the pressure back into a safer range, and within weeks the fog starts to lift. Not always completely. Sometimes damage has been done, but often enough that every geriatrician should be screening for this. I want you to do something for me right now. Think about your last week. Have you felt lightheaded when standing up from a chair? Even once? Have you had moments where you felt unsteady on your feet for no clear reason? Have you noticed your thinking feels slower than it used to, like your brain is working through mud? Have you felt unusually tired even after a full night of sleep? Do you sometimes feel weak in your legs when you first stand up in the morning? If you answered yes to even 2 of those questions, your blood pressure might be too low. Not might be fine, might be too low. And that is a conversation you need to have with your doctor immediately. Not next month at your regular checkup. This week. Here's what I tell every patient in my practice who's over 65. We need to measure your blood pressure in multiple positions. This is called orthostatic vital signs, and it should be standard for every older adult, but it's not done nearly often enough. Here's how it works. You lie down flat for 5 minutes. We take your blood pressure. Then you sit up. We take it again. Then you stand up. We take it one more time. We're looking for drops. If your systolic pressure drops more than 20 points from lying to standing, that's orthostatic hypotension. That's a problem. It means your body isn't compensating fast enough, and you're at high risk for falls and all the complications that come with chronic low perfusion. This test takes maybe 6 minutes total. You can do a version of it at home if you have a blood pressure cuff, and it gives you information that a single sitting blood pressure reading will never show. Let me walk you through exactly how to do this at home, because I want you to have this information today. First, you need a home blood pressure monitor. If you don't own one and you're over 60, get one this week. It's not optional equipment anymore. It's a basic health tool. You can find a reliable one for $30 or $40 at any pharmacy. Get one with an arm cuff, not a wrist cuff. Arm cuffs are more accurate. Once you have it, here's the test. Lie down on your bed or your couch. Rest quietly for 5 full minutes. Don't talk. Don't look at your phone. Just rest. After 5 minutes, while you're still lying down, take your blood pressure. Write down both numbers. Now, without sitting up first, stand up directly from lying down. The moment you're standing, or within 30 seconds, take your blood pressure again. Write down those numbers. Now compare them. If the top number, the systolic, dropped by 20 points or more, you have orthostatic hypotension. If it dropped by 30 or more, that's severe, and you need to talk to your doctor immediately. Bring these numbers with you. This is objective data. This is evidence that your current medication regimen may not be right for your body. Now, let's talk about what the safe range actually is for someone your age. Because if too low is dangerous, you need to know where safe actually sits. Based on current research, and I'm talking about studies published in the last 5 years specifically examining older adults, here are the targets that show the best outcomes. If you're between 65 and 74, a systolic pressure between 130 and 140 is ideal, not 120, not 115, higher than that. If you're between 75 and 84, the sweet spot is 135 to 145. Yes, 145. I know that sounds high if you've been told your whole life that anything over 130 is hypertension, but for your age, for your vascular system, 145 with no symptoms is far safer than 115 with dizziness. And if you're 85 or older, or if you have significant frailty, multiple chronic conditions, history of falls, the appropriate range may be 140 to 150. I can already hear some of you saying, but my doctor told me we need to get it under 130. I understand the confusion. Many physicians are still working from older guidelines that didn't differentiate by age. Some are aware of the new research but haven't changed their practice yet. This isn't about your doctor being wrong or bad at their job. This is about medicine evolving, and sometimes that evolution takes time to reach every clinic. Here's what I need you to understand though. You have the right to ask questions. You have the right to say, I've been reading about age-specific blood pressure targets, and I'd like to discuss whether my current goal is appropriate for me. You're not being difficult, you're being an informed patient, and informed patients get better care. I've had patients tell me they were afraid to question their doctor, afraid they'd seem like they were challenging medical expertise. Let me be very clear. A good doctor welcomes questions. A good doctor wants a partner in your care, not a passive recipient of orders. If your doctor becomes defensive or dismissive when you ask about your treatment goals, that's important information. It might be time to find a doctor who practices collaborative medicine. So let's talk about what you say at that appointment. I'm going to give you a script, actual words you can use. Write these down. Question 1, given my age and my overall health, what is my individualized blood pressure target? And what evidence is that based on? Not, is my blood pressure okay? Ask for the specific target and the reasoning behind it. Question 2, can we check my blood pressure lying down and standing up to screen for orthostatic hypertension? This puts the test on the table. Most doctors will do it if you ask directly. Question 3, I've been experiencing some symptoms, dizziness when I stand, fatigue, foggy thinking. Could any of these be related to my blood pressure being too low? This opens the door to considering overmedication as a possibility rather than defaulting to other diagnoses. These 3 questions, asked calmly and clearly, can completely change the trajectory of your care. Now, I need to address something important. Some of you watching this are on multiple blood pressure medications, maybe 2, maybe 3 different pills, and you're wondering, if my pressure is too low, can I just stop taking them? Please hear me on this. Do not stop your blood pressure medication without talking to your doctor first. Stopping suddenly can cause dangerous rebound effects. Your pressure can spike. You can have a stroke. What I'm asking you to do is have a conversation about adjustment, about tapering, about finding the right dose for your body at your age. This is a collaboration between you and your physician. It's not something you do on your own, but it is absolutely something you should bring up if you're having symptoms. Let me tell you what happened with Margaret after we adjusted her medications. We didn't take her off everything. We reduced one medication and eliminated another. Her blood pressure stabilized around 138 over 82. By the old guidelines, that would have been considered too high. She would have gotten more medication, but for Margaret at 78, it was perfect. Her dizziness stopped within days. The mental fog began to clear within 2 weeks. 3 months later, she was back to managing her own finances, something her daughter had taken over because Margaret kept making errors. 6 months later, she was volunteering at her church again. She got her life back, not because we found some miracle drug, because we stopped over-medicating her, because we treated her like a 78-year-old woman, not a 45-year-old man from a clinical trial done in 1995. This is happening right now to people you know, maybe to you. And the most frustrating part is how preventable it is. A simple conversation, a simple test, a simple adjustment. That's all it takes in many cases, but it requires awareness. It requires you to know that too low is just as dangerous as too high. It requires you to recognize the symptoms. It requires you to advocate for yourself. And that's why I'm making these videos, because this information should be common knowledge, and it's not. It should be discussed at every senior checkup, and it's not. So I'm telling you directly, if your blood pressure is consistently below 120 and you're over 65, you need to have a conversation with your doctor this week. Not eventually, this week. Let me give you an action plan. 3 specific things you can do in the next 7 days. Step 1, do the lying to standing blood pressure test at home. Write down your numbers. If you see a drop of 20 points or more, that's your evidence. That's what you bring to your doctor. Step 2, make an appointment. Not your regular checkup in 3 months. Call tomorrow. Tell them you're having symptoms and you need to discuss your blood pressure management. Get in this week or next. Step 3, bring the 3 questions I gave you. Write them down on a piece of paper. Bring the paper. When you get nervous or rushed, you'll have it right there. Ask all 3. Don't leave until you get answers that make sense to you. Now I want to hear from you. Have you experienced dizziness when standing up? Has your doctor ever checked your blood pressure in multiple positions? What is your current blood pressure and how old are you? Write it in the comments. I read every single one, and your experience might be exactly what someone else needs to hear to take action. If this video gave you information you didn't have before, share it. Send it to your spouse, send it to your parents, send it to your friends over 65. This is a conversation that saves lives and prevents suffering, and it needs to happen in every household with an older adult taking blood pressure medication. Next week, we're going to talk about something just as important and just as misunderstood: heart rate targets for seniors. Because just like blood pressure, the numbers you've been told to aim for might be completely wrong for your age. You won't want to miss that one. Subscribe to Dr. Arya Senior Health so you don't. And one last thing before you go. Everything I've shared today is based on current medical research and my 25 years of clinical experience in geriatric medicine. But it's general information, not personal medical advice. Your situation is unique. Your medications, your history, your specific numbers, they all matter. Use what you've learned here to have a better, more informed conversation with your own physician. Make them your partner. Make sure they know you're paying attention. Take care of yourself.